Okay. Good morning, everybody. My name is Douglas Hughes, and I'm the interim president and CEO of Grandview Health. I'm pleased to welcome you here this morning for a very exciting announcement from the acting secretary of the Pennsylvania Department of Health, Keara Klinepeter. Before we get started, I'd like to introduce you to three members of our leadership team. It is in no small part due to their efforts that we have gathered here today. First, Cindy Westfall, our Vice President and Chief Nursing Officer, Jan Rossi, our Vice President of Human Resources, and Sally Schulberger, our Environment and Care Coordinator and in charge of all of our disaster planning. I'd like to also acknowledge a very important partner, Kim Everett, Executive Director of the Bucks County Health Improvement Partnership, or BEATSHIP, who has facilitated communication between all the hospitals of Bucks County. Thank you for your help. And also Bob Harvey, our Commissioner of Bucks County, who's over there. Flashback to the week of July 12th. For the first time in over a year, we had 0 COVID inpatient hospital patients in our hospital. We hoped it was the beginning of the end of COVID. Turns out it was the beginning of a whole new and difficult wave of COVID, but we were ready. I could not be more proud of the team here at Grandview Health and their response throughout this pandemic. As COVID again began to impact our community, our team rallied at the hospital and throughout our health system, taking care of our patients, performing countless COVID tests, and administering monoclonal antibodies. They sacrificed their holidays, weekends, and nights. They fought through the COVID impact that was having on their own families while caring for others. They held the hands of patients too sick to have a loved one at their side, comforted families throughout some of their darkest days. Our nursing supervisors expertly managed beds to assure sickest patients could access the highest level of care. They weathered the storm throughout staff shortages, supply chain issues, and the sheer physical and emotional exhaustion that comes with doing battle every day in and out. It is important to note, many, despite having been vaccinated and boosted, also fought the virus themselves. While today there is a lot of discussion about nurses, I'm confident that our nursing staff will be the first to admit that without the support of all the staff of the hospital and our organization, the delivery of high-level, quality health care would be next to impossible. COVID has been a relentless foe. We certainly needed a break in more ways than one. To tell us a little bit more about those breaks, please join me in welcoming Pennsylvania Department of Health Acting Secretary Keara Klinepeter.
Thank you so much, Doug, Cindy, Sally, Grandview Health, for hosting this event today and for just being our relentless partners throughout this pandemic. What you guys are doing is truly nothing short of heroic, and I'm sincerely grateful to each of you. I also want to thank GHR CEO John Quick for being with us today. We'll hear later from him as well as GHR's VP of Nursing, Tanya Fornellos, both of whom have been extraordinary partners to the Department of Health and all Pennsylvanians over the course of the pandemic. I really appreciate all of you being here today. The Wolf administration and the Department of Health are extremely grateful for the continued efforts of all of our healthcare workers on the front lines in the continued fight against COVID-19 as the number of hospitalizations push facilities towards maximum capacity. We're seeing across the state and across the nation that everyone in the community who needs care is affected when hospitals are forced to deal with the unprecedented capacity and workforce-related challenges exacerbated by COVID-19. Regardless of why a patient is admitted to the hospital, if they are in the hospital with COVID-19, they require extra care and special medical precautions that put additional strain on staff and hospital resources. That is why it is truly a pleasure to announce the first state-directed healthcare strike team was deployed on Saturday night here at Grandview Health. Sorry, the gloves make the page turning difficult. The registered nurses and respiratory therapists providing short-term relief here at Grandview are being provided through GHR Healthcare under a contract with the Department of Health. The Department of Health is working to deploy additional healthcare strike teams to hospitals across the state who request assistance. This is the first component of the Wolf administration's multi-layered initiative to support Pennsylvania's healthcare staffing shortage amid the COVID-19 pandemic. The department notified hospitals last week of the process to request short-term staffing support strike teams. Requests for staffing assistance are accepted on a rolling basis. Evaluations to match requests with available resources will be conducted twice a week. The department is contracting healthcare professionals through GHR Healthcare, which is focusing its staff engagement and recruitment on healthcare professionals from outside of the Commonwealth to avoid heightening current staffing limitations within the state. State strike team members, which include physicians, advanced practice providers, nurses, and respiratory therapists, will be providing short-term staffing assistance for 7 to 14 days. Hospitals will be responsible for managing day-to-day work assignments for those strike team members. The intent is that these staff will fill in for a limited time while hospitals develop their own longer-term sustainable staffing solutions. Staffing resources are scarce and will be prioritized to address the most acute needs and maximize system-wide impact. We may not be able to fulfill every request, but we will be doing everything possible to support our healthcare workers. I'd like to note that these state-directed healthcare strike teams are separate from the federal strike teams deployed in late December to Scranton and York. Another way the Wolf administration is working to relieve pressure on hospitals is by encouraging residents to avoid seeking COVID-19 tests at hospitals. In addition to offering free testing services at schools across the state, there are now more than 960 locations in Pennsylvania where people can find free COVID-19 testing. In the coming weeks, we will be launching additional initiatives to relieve pressure on healthcare workers and hospitals. Let me remind everybody that we all must do our part to end this pandemic. That means get vaccinated, get boosted, get tested if you don't feel good, and wear your mask in public regardless of your vaccination status. We are all in this together, and it is going to take each one of us to continue to get us out of it. Now I'd like to welcome GHR CEO John Quirk to say a few words before we take questions. John?
Thank you so much, Acting Secretary Klinepeter. Doug, thanks for having us up here today. My name's John Quirk. I'm the CEO of GHR Healthcare. As was mentioned today, we provide healthcare relief staff to all of our clients. Grandview has been a great partner for many years. We've worked with the Department of Health for a couple of years since COVID began, and as Acting Secretary Klinepeter mentioned, Saturday night we started the relief staff to support and help Grandview's staff to get some much-needed relief and help. So we were very pleased and proud to work with the Department of Health, working with Grandview, supporting RNs and respiratory therapists as early as, like I said, Saturday started, and we couldn't be more proud and pleased to work with you. Thank you so much.
Excellent. Well, I'm happy to take questions and also to engage GHR and Grandview Health in any questions that folks may have.
And how many could be helped at one time?
So we've received a total of 3 staffing requests, but we're receiving them on a rolling basis, and then decisions are made Tuesday and Thursday afternoon. It's hard to judge exactly how many strike teams will be able to deploy at once, since each strike team is customized based on what resources the hospital needs. So for example, a hospital might need 10 RNs and 2 respiratory therapists, while another might need a physician and a physician extender. And so we're going to be working to customize these staffing solutions for hospitals and deploy them within 48 hours of making a decision on the request. So we're going to be working with GHR to bring on as many as possible. I think it's not just a matter of the sheer number, but getting the right types of providers in place. And GHR will be supporting not just our hospital acute care strike teams, but also our regional decompression sites and our SNF decompression sites.
Is there any thought or any plans to try and help hospitals with A, testing, and B, setting up sites so that you can administer monoclonal antibodies so that the hospitals then can focus on their other patients?
So the department is already doing an extraordinary amount related to testing. We currently have 9 testing sites across the Commonwealth to provide free, no appointment necessary, community-based testing. One of those is nearby in Berks County. But we also have recently received 2 ICAT testing sites from the federal government that can do 1,000 tests a day. Those are located we're going to be starting one in Delaware. The Delaware County one launched last week, and Dauphin County will be launching this week. With respect to monoclonal antibodies, the Commonwealth receives such a limited number of effective monoclonal antibodies. Last week, we were given about 1,800 doses from the federal government. We had requests in for over 22,000 doses. And so right now, we're mostly focused on advocating to the federal government to receive additional monoclonal antibodies. I think that's where our focus should be, as opposed to standing up more staffing support.
What is the process hospitals need to go through to request this staffing? Are there specific criteria? Do they have to be nonprofit? How do they qualify?
Any acute care hospital in Pennsylvania can request assistance. They use an existing process, so we're not reinventing the wheel here, where hospitals will work with their county EMA and their hospital healthcare coalition in order to put a request through the PEMA portal, which is an online resource. PEMA then shares all of those requests with the Department of Health, and we use a variety of criteria to make decisions about which hospitals we're going to deploy resources to.
And how many people came in to help Grandview Hospital, and from what state do they come in from?
I'm happy to turn that over to Grandview.
Good afternoon, or good morning, everyone. We had Saturday night at 7 o'clock, we had 4 nurses and 1 respiratory therapist. Sunday night, 4 nurses and 1 respiratory therapist. And then tonight they'll be dispatching 3 nurses, 2 of which will go to our ER, which is one of our hardest, most challenging areas for staffing right now.
And are they from 7 to 14 days? Do you guys know how long they will be helping
14 days deployment, yep. And they'll be here and our greatest need is on night shift, so 7 p.m. to 7 a.m. they've been coming in.
Are there any other longer-term solutions that you're thinking of doing or that the state is thinking of?
Well, we're working on long-term solutions all the time. We've partnered with nursing schools in the area to see if they can get us extra help as well, and working on many different solutions. Right now, 14 days is going to be a big help for us to get through this surge. We had 45 inpatient COVIDs 10 days ago. We're down to 32, but we're kind of riding the wave. We call it riding, just kind of riding the surge. That's a lot. That's a third of our acute medical beds are taking care of COVID inpatients. So we think by then, in 14 days, we should be even lower. We're looking at the numbers in the community, the positive numbers in the community. We're constantly surveilling. And so we think the surge will be less, hopefully down to maybe 20 inpatients, and that way we'll have a lot more capacity throughout the entire organization.
Is the staffing issue a combination of high patient count? Have you had staffers leave during this? We're seeing this great resignation everywhere,
Yes.
including healthcare.
Yes, all of the above. We have an unprecedented 30% increase in inpatient volume since this time last year. So we went from 90 inpatients last year on this date up to 140 today. So that's an incredible increase of all kinds. It's COVID patients, trauma patients, MIs, strokes. And so, yeah, we've had that increase. And then we knew that we were going to have a nursing shortage in 2020. Many of us knew that, and we were putting in place contingency plans for that. What we didn't know was we were going to have a pandemic and a nursing shortage, and to your point, the Great Resignation, which has affected all of our ancillary areas and non-nursing areas as well.
In some states, when we expect hospitalizations to start coming down at this point.
Sure. So Omicron continues to spread rapidly across the Commonwealth. So in the last 7 days, we have seen a slight decrease in the total number of cases. But I want to be really clear. If we are averaging 20,000 cases a day, that is an extraordinarily dangerous level of community spread that is happening. And so even if there is a slight decrease in the overall total number of cases, 20,000 still outstrips the previous highest by about 7,000 cases a day. And so we are not out of this yet, which is why we need every Pennsylvanian to continue doing their part. With regard to hospitalizations, we did see a slight decrease in hospitalizations over the weekend, but again, we are still over 6,000 people hospitalized. That is a prior year's all-time high, and we're sustaining it at this point. And so this is still an extraordinarily serious situation. We know that hospitalizations lag a couple weeks behind cases. And so again, when we're seeing 20,000 cases a day, that is still not, we are not out of this yet.
Secretary, given that the state data, as you mentioned, does show that there was maybe perhaps a peak in hospitalizations about a week ago, and that we're hearing from some hospitals that they will appreciate the help whenever they get it, but that they could have used it weeks ago. What else can you tell us about the timeline for the other support that the state has talked about, the overflow hospital?
So the department has been working collaboratively with the hospitals through section meetings that I host every 2 weeks. Every hospital is invited, Sally and I were just chatting about it before, as well as our EMS providers, in order to work with them carefully around topics like diverts, load balancing, worker recruitment, et cetera. So we finally were able to free up some dollars in order to put these supports in place. We are, in addition to providing short-term staffing relief for hospitals, going to be establishing additional regional decompression sites. We did find out that FEMA has extended the Scranton and York locations, and so we will be standing up more regional decompression sites, as well as skilled nursing facilities that will have locations in each healthcare coalition region, as well as 2 in the Northeast and 2 in the South Central, because they've been the hardest hit areas. I can't emphasize enough that while we are seeing perhaps a slight decrease in overall hospitalizations, ask these guys. Over 6,000 hospitalizations across the Commonwealth is no joke. Workers are tired and they deserve a break. And so that's what we're really here to do. And it also is incumbent upon every Pennsylvanian to do their part to help as well. Yeah.
About freeing up dollars, how much is this costing? Do these workers then go to the next hospital? And are the hospitals helping to pay for this as well?
No, hospitals will not be charged. This will be made free to the hospitals. The Department of Health will be working with PEMA in order to obtain FEMA reimbursement for these services.
Where do the workers come from?
I will let GHR answer that.
Tanya, can I introduce you real quick? Tanya Fernellis is our VP of Nursing Services. She does all the heavy lifting.
Good morning. Our nurses are coming from pretty much all over the country. We are concentrating on recruiting from outside of Pennsylvania as to not to heighten the staffing shortage that already exists. So we are pulling from all over. We had nurses in from Delaware this weekend that helped, New Jersey, and of course we're recruiting from all over the country. So you'll have nurses coming in from as far as Texas, and I think there were a couple that were coming from Seattle as well. So that's where they're coming from.
Is it just nurses, or did you guys say some doctors as well?
Yes, we are using physicians as well, and they are coming from, again, across the country. We also have nurse practitioners and physician assistants that we will be deploying as needed, as well as respiratory therapists.
What is the timeline for the rest of the state support?
So our goal is to have the SNFs stood up as early as next week. We have to contract individually with each SNF, and so I anticipate that we will be bringing those resources online again as early as next week. I don't think we'll have all of them up and running by then. Again, we're trying to work collaboratively with the facility, and they're quite busy right now. Our regional decompression sites, I anticipate, will be online again probably early to mid-February.
Crisis standard of care as well. Do you anticipate that happening in hospitals in Pennsylvania? And if not, why do you think it won't happen?
We've heard anecdotally from hospitals that they feel like they've moved to either contingency, if not crisis standards of care. The Department of Health does not have the authority without a disaster declaration in place to permit hospitals to move to crisis standards of care. And so I don't anticipate there will be further action there. And I'm sorry, did you have a follow-up?
Those are skilled nursing?
Yes, sorry.
And then the other ones are for hospitals?
Yes, skilled nursing facilities, and then the hospital regional decompression sites.
And are those existing sites that will be like deemed a site, or are you building from the ground up?
No. So we're finding facilities that have excess capacity. That is, they have more licensed beds than staffed beds. So we'll be using their existing infrastructure.
And do you anticipate the hospital decompression sites one in each region?
No, I don't anticipate that we will have the resources nor the need to do that. We are seeing that some regions, particularly the South Central and Northeast, are more impacted. And so we'll be targeting those scarce resources where they're needed most.
Do you anticipate the Southeast getting one?
I'm not sure right now.
We saw early in the pandemic with vaccines and things like that, that it was kind of federally managed when it came to the city of Philadelphia. Is that the same for their hospital requests if they need something for, say, Philadelphia hospitals, or is this across the state that you take this call for help?
Yeah, so we're going to be working collaboratively with Philly throughout the process to provide support to hospitals who need it. Okay, anything else, GHR, Grandview, you want to share with the group? Okay, excellent. Thanks, guys.